Bismillahirrahmanirrahim. So we're ready to begin the second part of our really important talk, and welcome again our two guest speakers who've honored us with their presence, and for any of our audience who weren't here before. So we're really honored to have with us Dr. Khwaja Nijamuddin and Dr. Muhammad Al-Dalla, who are consultant diabetologists, endocrinologists, so senior NHS doctors at Royal Blackburn Hospital, who've taken out their time and put a lot of effort in to talk to us about diabetes in Ramadan. So I'm going to hand it back to them.
Jazakallah khair. Yeah, just a brief summary of what we spoke about. What we spoke and on the topic like before the Maghrib prayer. We had a brief introduction about diabetes illness, which is essentially means the body is unable to utilize sugars or carbohydrates that we consume. There are two different types. One is type 1 and second is type 2. Type 1 is when the body does not produce any insulin, while insulin is required to take the sugars from the blood to the cells. And type 2 is when the body do produce insulin, but it is resistant to insulin. And type 2, we give medications, tablets, but later on people may end up on insulin as well. And then we also discussed that it is a dynamic process. The risk to diabetes during Ramadan changes from year to year, and it will change from, it varies depending on the geographical location, and it also is basically defined by the patient social circumstances, for example, work circumstances, comorbidities, and all these aspects. I'll pass on to Dr. Ali to carry on with the talk. Thank you.
Jazakallah khair. Assalamu alaikum, everyone. To continue with what Dr. Nijamuddin has mentioned with the introduction and the background, we'll move to the next slide. So we know that fasting, our bodies will go into fasting state after nearly 8 hours of stopping eating and drinking. And that's what happens in Ramadan. Most of the times that fasting will exceed the 8 hours time, unless we are living like in a part of the world where the daytime is very short. So this, just like to know that when the body starts sort of burning calories with no input of food is happening during fasting time. This is just a graph to show you from looking at few healthy people who do not have diabetes, and you can see from the red line, this is during Ramadan, and the blue line is before Ramadan, and these lines represent the sugar levels. So we can see from the graph, like nearly the middle of the graph, this is the time of iftar, and that is when during Ramadan the sugar level will go high, while before Ramadan most of the time the sugar level will remain nearly steady. And that is for healthy people. If we look at this graph, and this is just to compare to the previous one, this is for people who have diabetes, and the red line is when they are fasting, and the blue one is when they are not fasting. And we can see that the red line is going down slowly from start, like from Sahri time, going down to the iftar time. And this one you can see the difference between the blue and the red line. And at the time of the iftar, you can see the red line is going up, and that's when people break their fast, probably having too much of carbohydrates and sweets at the time of iftar. But this is the expected response for people who do have diabetes. And even we saw in the previous graph, there is a bit of a difference, but with diabetes, it becomes more evident and obvious and clear. And this period of the sugar level dropping down, as you can see from the purple colors at the bottom, these are the risky sort of time when the diabetic patients become at higher risk of developing hypo. And as we mentioned before the Maghrib prayer, hypo is when the sugar level drops very low. And this is mainly for patients who are on insulin, for example, or tablets that can put the sugar level down. The research, as we saw from the previous slide, suggests that people with diabetes on insulin are at higher risk of developing a drop in their sugar levels, which is called hypo. And having episodes of low sugar readings prior to Ramadan can put them at higher risk of developing this condition of low sugar reading during Ramadan if they decide to fast. And the risk to fasting with diabetes, as Dr. Nijamuddin explained before, it is a dynamic process and it can change from year to year. I will hand back to Dr. Nijamuddin for the next few slides.
Jazakallah, thank you. So as we mentioned earlier on, risk stratification is the foremost important thing that the patient should know, and the clinician as well, when we have a discussion around diabetes in Ramadan. It essentially means how high risk the patient is when you are actually, discussing fasting with them, and what measures should be in place, or what changes we should do as a physician or as a clinician for their diabetes management going forward while they're planning to fast. Ideally, this should be done weeks before Ramadan, 6 to 8 weeks before Ramadan, so that the changes are well established when it comes to fasting. There are different tools and criteria by different organizations and guidelines that are followed. We will, on the next slide, we will show you one from Sahaf. But this risk essentially, just as I can simplify that to my audience here, that if you have type 1 diabetes, you are high risk compared to type 2. Just a reminder, type 1 diabetes is the one which require insulin right from day one, when the body does not produce any insulin. It doesn't mean that type 2 diabetes is not at risk, but type 1 is relatively high risk to type 2 diabetes. Patient medication, again, if you're on insulin, as you can imagine, insulin can cause hypo, which is low glucose reading. You are high risk compared to someone who is, for example, on metformin. If you know, the drug metformin is commonly used for diabetes, which doesn't cause hypoglycemia. There are other tablets that can put you at high risk of hypoglycemia, and we will discuss that in the next slides. Then again, individual hypoglycemic risk. By that I mean, what's your job? What's your social circumstances? Your body habitus, your reserves. So these are individual hypoglycemic risks. How aware of hypoglycemia are you, in general with your diabetes? Some people don't have much awareness of their hypoglycemia. Their glucose reading drop down to, for example, 4. Less than 4 is hypoglycemia. They will drop down to 3.5 and 3. They won't have any awareness, which is a very serious issue, because by the time they get the awareness, it's late. They are actually in a semi-coma or coma state. So this is meant by the individual hypoglycemic risk. So if any of my audience experience hypoglycemias, then they are high risk, and they must discuss it with their physicians or their GP or the specialists. Presence of complication and comorbidities, which we briefly mentioned earlier on as well, because as we know that during Ramadan, hydration can be an issue for people who lose water, and people having diabetes, they lose more water. You may have heard, like if anyone has got diabetes, or you may have heard from your relatives, family members who have diabetes, they go more often to the loo. It's because they are getting rid of these extra sugars that is running in the blood, and that sugars takes the water along with it from the, and if you are fasting, you're high risk of dehydration, your kidneys are going to go worse, you are high risk of getting clots, you're high risk of getting, clots means stroke or heart problem or these sort of severe complications. Then individual social and work circumstances, which you briefly mentioned earlier on, depending on the nature of your job. For example, I can say that if someone is working as a manual labor, like in Middle East, during month of March, versus a teacher here in the UK during the same month of March, they don't have the same risk if they both have diabetes. The one who is exposed to the harsh environment, high temperatures, is much higher risk, even if they are on the same medication, same treatment, and same duration or same control of the diabetes. So it's a very individualized approach should be followed for these patients. Along with that, more important, previous Ramadan experience. If someone had bad experience in the last year because they had to break their fast with their sugars being running high or low, or any other complications, medical, clinical problems, then you know that they are gonna get into trouble again this year. So you explore that. How was it last year? What was the experience prior to this year? So this is the one of the guidance, it's a simple one, it's for type 2 diabetes, and we thought it will be useful because we know that majority of our population has type 2 diabetes versus type 1 diabetes. And you can simply look into that. The high risk essentially means if someone has got poor control diabetes, this is in the American system, the 8.5%. If you know about HbA1c, we do it in millimoles here. So it is equivalent to 69 millimoles, that 8.5, which I, as a specialist, see quite few people having HbA1c more than 69. So we have to be careful, in assessing these patients and guiding these patients. Again, I must say that above 69, it on its own is not a reason to say that you shouldn't fast. Someone in HbA1c of 70 or 71 doesn't mean that they shouldn't fast. But yes, if they are high risk otherwise because they are poor controlled diabetes with hypoglycemic unawareness, for example, or they had previous bad experiences, then they are very high risk. And again, this is a reason to say that, even before Ramadan, you work more towards your diabetes management a month or a couple of months before the Ramadan, so that you bring down your HbA1c. In a similar fashion, for example, if any of your relatives or any of the patient themselves have been experienced the elective surgery, for example, if they are going for elective surgery, they say, let's work on the diabetes, make it better to prevent complications to happen. The same applies here for Ramadan. It's Ramadan coming, start working on your diabetes. If it is not very well controlled, 3 months ahead, 2 months ahead of that, and you are much safer and you enjoy your Ramadan, the month of Ramadan, rather than getting into any trouble. The other high risk or pregnancy is the one. I myself, I do pregnancy diabetes clinic for East Lancashire, and I have a chat with my patients about pregnancy and diabetes, especially if they are on insulin or if they are not very well controlled, they are very high risk. And of course, it is actually two souls involved here, the woman and the baby. So it's a serious consideration to inform them that pregnancy in itself, we know that it's an exemption from fasting. But I still find our Muslim women who are keen to fast coming to those clinics, and I have to discuss with them based on what the guidance suggests. And at the same time, I sometimes go outside the guidance and clinical thing. I said, I myself, I deliver talks on this, and I fast as well. So this is what I would suggest. Then moderate risk or medium risk is someone having middle range HbA1c or having moderately controlled type 2 diabetes, being on oral agents that can cause glucose lowering agents that doesn't cause hypoglycemia, or if they are on once daily insulin. Basal insulin is once daily insulin. GLP-1 receptor agonist is the drug that you may have heard about, the weight loss medication, which is essentially for diabetes as well. It is a diabetes drug, but it helps in losing weight, and people source it privately as well. So it puts them at moderate risk of fasting. Ideally, I would recommend, if it is just for weight loss, if you are sourcing it privately, don't do it during Ramadan. You can always take a break of a month from that, especially if it is not very well monitored, through clinicians. Then, of course, low risk are people who have very well controlled diabetes, or if they're on just one agent, or otherwise in good health, or if they are like, diet controlled diabetes. So the recommendations, if someone is high risk, what do we do? They must receive structured education, individualized structured education, how to address their, health needs or in regards to their diabetes. And it should be by a qualified diabetes team. And we are talking about the high risk patients. And they must check their glucose very regularly. And currently we have CGM. You might be aware of the continuous glucose monitoring, the Libre, Dexcom, or the different technologies that we use, where you get that coin size patch on the skin, and it talks to the phone, and it delivers it actually communicates to the phone, giving the sugar readings continuously. So that's a blessing for people having diabetes. You can use that during Ramadan, and it helps you having multiple readings throughout the day to keep yourself safe. And of course, adjust medication dose as per recommendation, which we will discuss later on towards the end of the lecture. And be prepared to break the fast if you are in a hypo or hyperglycemia. And this is something that you have to actually be prepared beforehand. rather than waiting for it to happen and then you are questioning, should I break my fast or not? You should be very clear in terms of what are your necessary essential steps, including breaking your fast, if it comes to that, and what is the criteria. And here is the guidance about, we will show you the glucose number that you can utilize as a criteria for breaking the fast, because you are at low risk that Dr. Ali just mentioned about the thrombosis, which is the clot formation, dehydration, ketoacidosis, which is the acidic blood. You are at risk of all these serious problems otherwise. So I will pass on to Dr. Ali again to talk about the next few slides then.
So as Dr. Nijamuddin mentioned, there are a few things to consider for someone who is at moderate risk or high risk and deciding to fast during Ramadan. If their sugar level dropped to less than, as per this, you can see on the slide, if their sugar level dropped to less than 3.9 or goes to more than 16.7, and those who have diabetes or they have relatives who have diabetes, they know what these numbers mean. And if someone is having symptoms of low sugar reading, then also they will likely need to consider breaking their fast. Or if they become unwell, for example, having viral illness or other acute illness, then they need to consider breaking their fast. This is a common picture that we show to our patients, or dietitian use to show to the patients about what's healthy food, or what they call it eat well plate. And as you can see, the green bit is the vegetables and fruits that should represent around 30% of our daily food intake. The yellow one is the carbohydrates like bread and pasta, potatoes and so on. The blue one is the milk and dairy products, which would represent probably around 15%. The pink one, as you can see, is the meat and eggs. And then they leave a bit of 5–10%. The purple one is the takeaway food, like burgers and pizzas and so on. So to keep the food intake healthy, that is the advisable way of dividing our daily food intake. And the same applies during Ramadan. And actually Ramadan, as we know, it's a month for training ourselves for self-discipline. But what happens, unfortunately, people get used to do, the moment they break their fast is like an open buffet that should continue until Sahri time to compensate for the fasting time. And then maybe some people actually tell us that they gain weight during Ramadan. So that's something need to consider. It's not just about the type of food, but also when they break their fast, to have sort of a moderation in eating, I should call it, and then try not to eat much unless needed during the time between iftar and sahri as well, and this will bring the benefit and also the training that Ramadan is for us to learn from. This is a nice slide about the timings of when to monitor sugar levels during Ramadan for those who have diabetes. And the advice usually, if the time is short during Ramadan, like during winter, to check before iftar, 2 hours after iftar, just before sahri, and then during midday. And the 5th time if the diabetic patient becomes unwell or feeling symptoms of hypo. During summer, like when we have long days to fast, then we can add 2 other checks in addition to the ones I've already mentioned, as you can see in the picture. Now we're coming to the medications. So all diabetes patients will know what medications they usually take. And we'll start with the tablets. This is mainly for type 2 diabetes patients. The metformin is a common medication, which is usually first line for diabetic patients. And there is no particular sort of changes that are required during Ramadan. So if someone is taking metformin morning and evening, they will take it with iftar and sahri. If they are taking 3 times a day, they will combine the first and second dose with iftar and then the 3rd dose with sahri. The pioglitazone is not a very commonly prescribed medication, but if someone is using it, then should stay usually with the iftar time. Sulfonylureas, this is a class of medication, and the common one we use here in the UK is called gliclazide. And this is one of the medication that stimulates our gland, the pancreas, it's called, to produce insulin hormone. And because it's like, we can imagine the pancreas has gates, and these gates will not be opened until the sugar level goes up. That is in non-diabetic patients, or even in like type 2 diabetes patients. But if someone is taking these medications, these gates will be opened all the time, and the insulin hormone will be flowing from the pancreas to the blood all the time, or as per the duration of the medication staying in the blood. And this will cause lots of insulin in the circulation, in the blood circulation, and therefore, when there's too much insulin, this means that it's a high risk of causing the sugar level to drop below 4, which will cause the symptoms of hypoglycemia. So if someone is taking gliclazide, we would recommend to keep taking the medication twice a day. Take the medication with the iftar, but not to take it with the sahri time. And again, as always, it's important to discuss with the healthcare professional, whether it's GP or diabetes specialist, to decide whether to take the medication or not, depending on the risk of that specific patient. The other medications, there are some medication called gliptin, like sitagliptin, linagliptin. Again, there is no need to change the timing of this medication, and usually recommend taking them with iftar. The injections that Dr. Nijamuddin mentioned, the ones that can help with weight loss, like Mounjaro, Ozempic, you might have heard about these names. They call them the magic bullets to help people lose weight. These can be taken at the same timing if they are being used for diabetes. And the dose does not need to be changed. And then there's a medication called SGLT2 inhibitors, and many diabetic patients nowadays, especially type 2, they use them. And they can cause the sugar to go down with the urine, and therefore they take lots of water out of the body. So they can put diabetes patients at risk of dehydration. So it is important to, if the patient is taking them, then to take them with iftar, and to drink enough fluids during the time between iftar and sahri. I will hand the microphone to my colleague, Dr. Nijamuddin, for the rest.
Thank you. I won't bore you too much with different insulins, because there are quite few, and the names are tricky. But as a general guidance, insulin can be once a day, twice a day, or there could be 2 different types of insulin, one injection once a day, and the second one before each meal. So the last one is called basal bolus regime. Twice a day is usually a fixed mixed insulin, we call it. You may have heard the name Novamix 30, Himalayan M3, names like that. And once a day is just once a day insulin. So now the way it works is actually once a day covers you for 24 hours. The quick one before meal covers you for 4 to 5 hours. And the twice daily insulin covers you for up to 12 hours. So essentially, you think of the mechanism of action of this insulin and the timing you eat during fasting or Ramadan. Of course, you never inject insulin for lunchtime, 12 o'clock, 1 o'clock when you're not eating, irrespective of the type of the insulin. Now, you know that your main meal is iftar. So you will need more insulin for the iftar time. You know that the suhoor is not a big meal as you normally would do. So you may need to cut down on the suhoor dose of your insulin. So essentially, the guidance, the details written over there, what percentage you need to cut down. Of course, this will be discussed with you by your healthcare professional or the specialist when you discuss your individual situation with them for your diabetes management. And it says the human analog insulin, which is actually the human insulin but engineered. They are better because it's more predictable when it comes to the insulin activity compared to the other types of insulin. So the pre-mixed insulin, as we mentioned earlier on, it could be once a day, take normal dose at iftar. But if it is twice a day, then you know that you reduce the dose. Usual dose in the morning, dose at iftar, reduce evening dose by 25 to 50%. At suhoor, so actually you flip it. So your morning is evening, your evening is morning, because we know that the evening, the iftar is your big meal. So normally we are worried that we are not eating at night time. That's why we give a smaller dose in the evening. During Ramadan, we are eating more at night time compared to the daytime. So you flip actually the twice daily insulin, and you give relatively bigger dose in the evening and smaller dose in the morning. And you do further reduction, 25 to 50% as well, when you are talking about a smaller dose in the morning. This is all to prevent the hypoglycemias when it comes to insulin. If it is a TDS, you omit the afternoon dose. And this is about the mixed insulin again. As standard recommendation for diabetes patients, when they are on insulin, we ask them, please titrate your insulin every 3 to 4 days. The same applies here during Ramadan as well. If their sugars are off the scale, they can always increase or reduce their insulin, usually increasing insulin in 3 days' time. If it is a matter of reduction it, because they are having a hypoglycemia, low glucose reading, they should do it immediately. They are not waiting for 3 days. So the same principle applies here. Every 3 days, they should slowly increase their insulin, but be very vigilant and cautious during Ramadan. Insulin pump, you may have heard about the technology available for type 1 diabetes, people who do not produce any insulin at all. And there are better device or better way to manage your diabetes. And there are some recent studies we looked into in a couple of studies published last year actually, which showed that it will help reducing the hypoglycemia, low glucose reading, because the way it works is actually this insulin delivers insulin slowly, trickles into the system throughout the 24 hours. Now you can imagine if you in the daytime after midday or 4 or 5 o'clock, when you don't have your lunch meal and your glucose are running low, it will back off the pump. It won't deliver any extra insulin because it knows that you're running low. You don't need any extra insulin. So of course you don't end up with a hypo. Versus if insulin is injected through a pen, it stays there, it's slowly absorbed over 24 hours. Irrespective of what your sugars are, it's gonna get absorbed and you are at risk of hypoglycemia. So there are better way to manage type 1 diabetes in Ramadan, and it's more widely available, the insulin pumps. The bolus rate and the pump, people who are on pump, they will know that they have to tell the pump how much meal carbs they had, and it calculates the insulin based on that. So the bolus rate will remain the same. This is probably our last slide, so I'll pass it on to Dr. Ali, and yeah, we'll take some questions afterwards. Then thank you.
Thank you. So yeah, the key point really is if someone is, as we mentioned, might consider them as high risk, like for example, they had hypos, low sugar readings before Ramadan, or their control is not very well before Ramadan, then they need to consider not to fast Ramadan, and the advice is always to discuss with their healthcare professional. Getting the right amount of food, trying to get low, we call it low glycemic index foods, which get absorbed slowly, not to cause high sugar levels, and with fat, healthy fat, I should say, and protein, that will help, and fiber, that will help the food getting absorbed slower, especially at Sahri time. For example, having eggs with bread, that will have a good combination of fat, protein, and carbohydrates. And then having maybe a piece of fruit or vegetable or dates, that will give them a lot of fibers, and with a lot of fluids, that will help getting the glucose level sort of stable for the next like 4 to 6 hours after Sahri time. And glucose monitoring, as we said, it's important, as Dr. Nijamuddin mentioned, and as we showed in the slide of the timings of when to monitor sugar levels. And consulting the doctor is always important during Ramadan and before Ramadan. These are some useful resources that the patients with diabetes can use. So there's an app which is called Dar Safa, which is available on Google Play as well as on App Store. It has a lot of useful information, videos recorded about a lot of topics in relation to Ramadan and fasting, and the medications as well that we talked about. And there are some other useful resources, as you can see from the barcodes. Thank you to Dr. Nijamuddin, who summarized this and put these barcodes. So if anyone wants to use to look at these resources, can scan these barcodes. And I think we'll stop here and to see if there's any questions. I don't know if there's anything. Yeah.
So thank you for your lecture. So
Yeah, I will try to answer about the dates, and I'm maybe give the microphone to my colleague to give the rest of the answer. With regard to dates, there are different types of dates, as you know. And these dates, there's a nice study from United Arab Emirates about different types of dates and how much sugar in each type of date. There's, for example, there was called sukkari. It has lots of sugar, and this is one of the most like sort of powerful. If you want to break your fast with, you will feel the high after after breaking the fast. Well, for example, there are other types of dates, especially the dry ones. Ajwa actually is one of the ones that would have smaller amount of sugar compared to the sukkari one. And then other types probably come in between. So it depends really on the type of dates that we are breaking our fast or eating. For example, sukkari, I wouldn't advise of more than 3 because it has a lot of sugar in them. Maybe ajwa, I would say 5 or 6 would be equivalent to the sukkari ones. And I think for each diabetes patient, they will know, especially if they're using the continuous glucose monitoring, they will know like how their sugar level goes high. Or if they are using finger prick testing, they can check the sugar level after 1 or 2 hours from breaking their fast, and they can see where their sugar level is sitting at. But this is a general advice. I mean, each patient is different, so always in moderation, so smaller amounts. Some people will say, I always eat dates and my sugar level goes very high, but if you ask them, they will have like a plate of dates, like 10 or 12 dates, and this, of course, will put the sugar level very high. I will hand the microphone to...
Yeah, probably around the same lines, to be honest. There's no right or wrong answer when it comes to, the type, as long as we know what's the macronutrients of that diet. And one thing to consider, especially for suhoor or even for breakfast actually, as we know our cortisol level, which is the natural steroids, are at its peak in the morning. Our body is more resistant to insulin and we get sugar up spikes. So what I recommend for suhoor is to have something like mixed with fats, of course healthy fats, and not having a diet or meal that has got a high glycemic index, we call it. Glycemic index is actually a parameter used for the way the sugars are absorbed, how quick they get absorbed from any particular meal. I can give you an example of cereal, for example, which is not a typical one for our non-Caucasian breakfast, but cereal or cornflakes, it has got a very high glycemic index. The sugar spike like that on a continuous glucose monitor, and then it drops within 2-3 hours, and you feel hungry. So rather than doing something like that for suhoor, you go with, let's say, bread with fried eggs, which has got fats with carbohydrates in it. It gets mixed, it gets absorbed more slow. And if it is absorbed more slow, that means it's staying for a bit longer. So you feel full. Your body is able to utilize those sugars in a better fashion in the context of your insulin or medications you're on. The same applies for the iftar time as well. But in the iftar, as Dr. Ali mentioned earlier on, the problem is mainly the amount. That's unfortunately the situation. We feel like we are being stopped from eating, and now is the time. We keep filling ourselves up, and our body starts struggling with that. So it's more of of course, we do mixed, diets to begin with. Again, I must say that, I find it helpful in a way that if you break it, in a way that you do your iftar first, you do your prayer, and then you eat afterwards. Because it's not a term you use in diabetes, but I can say that your pancreas acclimatize to the sugars that you have consumed during iftar in the form of dates. So it's ready for the meal that is coming in to tackle it in a better way after, for example, Maghrib prayer. So that helps in that aspect as well. Particularly in meal, there's the eat well plate. That's what our guidance will be when it comes to a type of food or meals. I hope that answers the question. Yeah.
They are like the staple of our iftars. I think they are now doing sugar-free ones as well. Is there any sort of a study whether these sugar-free ones are as good, or do they have more harm for diabetes?
You've got more experience and sugar-free and diet. You can probably answer the question. I'm not aware of any studies as such.
So
but-
what is the food?
So ruh afza, it's a typical Asian, South Asian, I should say, or Pakistani typical, drink. The concentrate that you dilute, a squash-like thing, and it has got. It's a very well cultured thing during Ramadan. You drink it at iftar. It has got sugars in it. It is sweet, but yeah, as Dr. Zaid said, it is available and sugar-free as well now. So I think the question is more around sugar-free, whether that would cause any harm. It will be the same like Coke Diet to Zero, or fizzy drinks that has got zero sugars.
Yeah, I mean, I'm happy to try to answer the question if I may. With regard to sweeteners, previously, I mean, the advice from diabetes specialists is always to use sugar-free drinks. And these ones that have sweeteners, basically, because otherwise they will not have any taste and no one will drink them. But I looked, it's about 2 weeks ago or 10 days ago, there was a study published in France about 7 types of sweeteners which are most commonly used in food products, including fizzy drinks. And the results are actually shocking, because these patients were followed up for like 5 or 7 years, and it's not considered as a very long duration, but still it showed 16% increased risk of cancer, all types of cancer, compared to the other group who didn't consume these sweeteners. And the risk of type 2 diabetes, surprisingly, has gone up to 26% with this group of people who are consuming the sweeteners compared to those who are using just natural sugar. So I wouldn't recommend going to the sugary drinks, but I can't recommend the sweeteners either, because it looks like somehow they are causing a lot of problems. And maybe in the future there will be more studies to tell about these sweeteners. I think one of the sweeteners is called stevia. And what I found some people are doing, they are bringing the leaves, the plant leaves, natural ones, and crushing them and just mixing them with any drink, and they give the sweet taste, but they are not processed. But the stevia that we have from like with power as like powder or tablets, they pass through. I remember one talk in Edinburgh. They were talking about these sweeteners. They pass like through 10 or 12 steps of processing before they become like the product that we buy from the shops. So if you can get these natural, like a sort of natural, original, organic, what they call it, leaves, and use them for the purpose of sweetening the drinks, then that definitely will be better than buying these products from the market. Other way of sweetening drinks is using honey, although not always people enjoy the taste of honey, but small amount, yes, it will have some sugar in it, and it will cause the sugar level to rise a bit, but using them that as a natural thing compared to these processed products. I hope this answers your question.
Try to avoid it.
Yes.
Is it possible to, you mentioned the benefits of continuous glucose monitoring and insulin pumps, is it possible to get those on a temporary basis for in the days before Ramadan and to get people through Ramadan if they're not on that?
So it's only for type 1 diabetes patients, and it will be tricky in the current situation. I do pump patients mostly in the context of pregnancy, and Dr. Ali is doing pump clinics himself as well. And the waiting time, am I right saying 18 months?
Yes, the waiting time for pump.
Yeah.
I mean, yeah, for pump, we're trying to get it like closer, but yes, it's a very long waiting list. Yes.
So it won't be possible, and realistically speaking. But yes, people having type 1 diabetes, if they are in the audience and they are not on a pump, I would strongly recommend they discuss with their specialist to get enrolled now rather than later.
Can they get on private?
The sensor.
How much will it cost?
Oh, the sensor.
Yeah, the monitoring.
The monitoring, yes. They can get it private. And last I remember, it was around 50-ish for
Pack of 3 was for less than £100.
less than £100. It is for the Abbott one, the Libre. Library 3, Abbott. Yeah, you can buy it. You can buy it online and you can buy it. Yes, yeah. One sensor lasts 2 weeks.
Somebody is on tablet or somebody wants to monitor during Ramadan. Yes, that is a good way of monitoring it.
Yes, yeah. Yeah, for NHS, the criteria is you must be on insulin, 3 or more than 3 injections, or you are at high risk of getting hypoglycemia. For example, you have advanced kidney disease, chronic kidney disease, or you're on insulin.
Mounjaro doesn't cause drop in sugar.
It doesn't.
Then, people with obesity, can they not continue during Ramadan?
They can continue during Ramadan. Yes, they can Manjaro, and they don't need to adjust the dose. But the problem is it comes with some side effects, sickness, vomiting, and these sort of things. And we know that in Ramadan there is this intention of eating more than usual, so they may experience more of side effect compared to being outside Ramadan. I would strongly suggest, if it is self-funded, if it's not very well monitored, which usually is the case when it is self-funded, you can skip the month if it's just for weight loss.
If they are well, if they take it for a few
Yeah.
months, and if they want, rather than having a gap, if they want to continue,
They can.
they can continue.
It will be personal choice. Then yes, yeah, they can. Yeah. For diabetes, we don't ask them not to stop. I mean, they can continue for diabetes. Yeah.
Is there any questions from sisters?
Yeah. So the question is that if somebody has say hypo, or it's day 3 of Ramadan, somebody has a hypo, what should they do for the rest of the Ramadan? How should they get help, and what steps should they take, or the next fast, etc.
Yeah. So of course they should know that they have to break the fast the day 3. Now it depends the context of the hypoglycemia, and that's where we said that it's a very individualized approach. Now if they were getting hypos prior to Ramadan as well, and they had a hypo on day 3 again, they are high risk. They should not fast. That there is another extensive guidance available on IDF. The one we showed was from South Asian Health Foundation, SAHAF. That's more extensive, and it comes under that category. They should not fast if they had hypo. If it's just a one-off hypo with a clear reason that they injected themselves insulin, they didn't end up eating or eating well enough, then of course that is an avoidable one, and they can avoid that going forward, and so it doesn't happen. But if they are otherwise poor controlled, getting hypos once a week, that's what exactly the wordings of that guidance. Once a week hypoglycemia, and this has happened on day 3 again, they are high risk. They should consider not to fast.
So another question is as you said, the person should be preparing a month or 2 months before Ramadan. What's the best source of help for that? Should they be contact diabetes nurse or the GP? Who's the will they be able to see a consultant? What's the best way of?
So yeah, in the NHS, if they are under the GP, for example, that means they should be okay contacting their GP in the first hand. If it is the specialist nurse that is more quickly available to them, again, they can seek help from the specialist nurse. If they are under the consultant, then of course, what my experience, and the same is for the rest of our colleagues in the department, they can call the secretaries to the consultant, and they get looked into earlier, including their concern around Ramadan is coming up in next month, couple of months. Can we have a chat around it, and something will be arranged. So it depends. I mean, if someone is under primary care for diabetes, it will be difficult for them to be looked into for their diabetes management just for Ramadan only within a couple of month time period due to the way it works. That's why I mentioned the primary care in the first instance. Thank you. Jazakallah.
You need to go, I know.
Jazakallah khair to both our speakers for a really, really good talk, very beneficial, mashallah, very clear. You've obviously put so much effort into it, and we're very grateful that you put so much time and effort into making the presentation and taking the time out and sharing it with the audience. Jazakallah khair.